Hey, all you cool cats and kittens. Today, we're talking about here Chapter 9, which is our Bloodborne Pathogens, Universal Precautions, and Wound Care. This is going to be especially important for us, given the current, kind of scenario or situation we're in kind of the real world. And what I want to be talking about here today is just really a general overview of this. So this is from Chapter 9 here. Now, when you talk about pathogens, you're talking about anything that causes a disease. So if anything's a pathogen, it is disease causing. So it can be a bacteria, fungus, an amoeba, virus. Anything that is bad for you is considered a pathogen. If something's bloodborne, that doesn't just mean that it comes from your blood, but it typically is referring to any kind of pathogen that is transmitted by bodily fluids. So right now, the current outbreak of the COVID-19 virus would be considered a bloodborne virus because it's transmitted through respiratory fluids. So by the tiny water air particles that you're breathing out, anything like if you sneeze out, it would contain that. So anything that contains a bodily fluid would be classified under that bloodborne pathogen label. The majority of transmission, however, is going to really be seen really from blood, any sort of semen, vaginal secretions, or cerebrospinal fluid. Now, synovial fluid would be like if you had, say, you have your synovial fluid that lines all of your joint capsules, and it's very hard to transmit this way. I mean, more likely than not, you would be seeing this from the blood in that case, because you're not going to be encountering somebody's synovial fluid without having blood there too. The majority of bloodborne pathogens are not going to be transmitted on the field. They're going to be transmitted from off-field activities. So while it's still important to know and always treat everyone as though they do have a disease, most likely you're not going to catch anything on the field. It would be off the field doing like extracurricular activities where you would see a problem or see transmission occur. So like I said, you want to treat everyone, all athletes, as though they have a bloodborne pathogen, meaning you don't want to come in contact at all with any of their bodily fluids without protection. So this typically means gloves, mask potentially. Usually you're not going to be using a mask on the field, but you definitely want to be using gloves on the field. Even as something as simple as like getting sweat on you, while that's not necessarily a huge problem, you still want to have gloves on as a protective measure, and also as a kind of a way to have more of a better, like say, grip, or you're able to really palpate that athlete better than if you would if you were touching them skin to skin. Now, one thing to note about here is the ADA. The ADA is the Americans with Disabilities Act, and this was formed back in 1990. And what it essentially says is that you cannot discriminate against someone because of a disability. In the workplace, you can't, say, fire someone because of their disability. You can't exclude them from potentially being hired because of a disability. And then also in the athletic realm, you can't discriminate or exclude someone because of a disability. Where this is most applicable for collegiate athletes is if someone is an HIV carrier. So if you're HIV positive, you can't be discriminated against because of this. You can't or you're not allowed to be tested for HIV. So the school can't just say, here, take an HIV test. That's not allowed. Now, you definitely should encourage, students to regularly get tested for, especially like STIs or different bloodborne pathogens, especially if they do any kind of risky behaviors or high risk behaviors. But if you have something like HIV, you can't be discriminated against because it, meaning your coach cannot exclude you, or the university for that matter, cannot exclude you from your sport unless there are legitimate reasons that it would be a potential risk to yourself or others if you were to play that sport. Your school and your coach also are not allowed to disclose to anyone that you have something like HIV or you have any sort of protected disability unless you give them express consent to do so. So you can't be outed for having, say, like HIV. That is a big violation of the ADA. The only real cases where you would potentially have to be removed from participation is if you were not physically able to play or your health was deteriorating to the point where any further physical activity would be detrimental to you. Now, with wound care, this is going to be something that's much more applicable to you on the field. Most often, when you see wounds on the field, you're typically going to see a version of these first three here. So, and really, number A here is an abrasion. That's be like if you scraped your leg or scraped a body part. There's no definitive line of a cut. Like, so here, this is an incision site. You have a straight line here, or this is a laceration. A laceration is a cut. So you have really just a straight cut here. With an abrasion, this just means that the skin has largely come off. Now, if you have an avulsion is a much bigger version of an abrasion. But an avulsion may be caused by something along the lines of like an infection, or it can be a complication from a previous injury. It can be as a result of a pathogen. But you want to think of an avulsion as a much bigger, more systemic abrasion, but typically there's pathogens involved with it. Usually this here, the puncture wound or even an ulcer, wouldn't usually be seen by most athletes. You're really only going to get a puncture wound, if you were to like step on something sharp, which usually shouldn't happen like on the field. Maybe if you look at like, say, a baseball player, if they, hit someone with their cleat potentially, but that's kind of, really stretching it there. Typically what your main goal here is to control or stop bleeding. That is the main thing there. If you have something that's going to require stitches, the rule of thumb with that is that if you need stitches, you have a laceration, meaning you have a straight cut, or there's a cut or a straight line somewhere, or even a curved line causing the bleeding, and it won't stop bleeding after at least 20 minutes of compression. So if you have, like, say, a cut on your hand and you're holding something against, like you're wrapping it with gauze or a towel or something, and after 20 minutes it's still bleeding, that's an indication you need to have stitches. But with anything here, you want to stop the bleeding. Now, you don't necessarily need to clean the area on the field. Typically, an abrasion or a scrape, you'll want to clean. If you get, like, say, like a laceration, which is much deeper, or a puncture, or even potentially an avulsion injury, a lot of times those are deeper into the skin, and if you don't clean that with an aseptic technique or with a very good cleaning technique, you could potentially be pushing pathogens or bacteria inside that area instead of getting them out of the area. So the number one goal is to stop bleeding. You want to stop that bleeding first, and then you want to work on cleaning the area. Now with infections, we have a few of these. The main one we want to focus on here is MRSA. MRSA stands for methicillin-resistant Staph aureus, or Staphylococcus aureus. The majority of people actually have this living on their skin, and it doesn't cause any problems because it doesn't get into your body. Now, anything that has a resistance or a susceptibility means that you have a bacteria that has developed a resistance against a particular class of antibiotics. Now, antibiotics are only used for the treatment of bacteria. So if it's not a bacteria, antibiotics do not work. If you have a viral infection, if you have the flu, if you have a cold, if you have COVID-19, antibiotics will not work for you because those are viral infections. An antibiotic will only work on bacteria. Over the years, if you are overusing antibiotics, the bacteria become resistant to it. MRSA, way back in the early 60s, so 1961 is when this first started. Methicillin was first used in 1959. It took only 2 years for Staph aureus to become resistant to it. And one of the big reasons is overprescription of these antibiotics. So people that were doctors that were overprescribing this for virtually everything, bacterial, viral, whatnot, ended up causing this MRSA bacteria to gain resistance to methicillin. And methicillin at the time was the biggest or the highest level of antibiotic we had. So you could actually really see that, people would be much more susceptible to like death if you don't have a method to treat a bacteria. Now, Visa and Versa are other forms of Staph aureus, so the same class of bacteria, but now these are resistant to vancomycin. Vancomycin is like a step above methicillin. So when you get to the Visa and Versa status, that is when you have a major problem, because now your last hope is some really nasty antibiotics, like stuff that's going to, if it doesn't kill you, it'll save you, but you never really want to have to take them. So when you get an infection, a bacteria has really taken over the tissue. So when it says it colonizes it, this is what it looks like. You get a normal skin tear and it's bleeding and then you clean it out. When you start seeing all these pus things here, these pus pockets, that is collection of really dead white blood cells and the bacteria itself. So that's an indication you have bacteria there. If you look in the back of your throat and you see that you have, pus pockets on your tonsils, that's typically a sign you have bacterial strep throat, which can be treated by antibiotics. If you just have a red sore throat and there's no pus pockets on there, then you most likely have a viral strep throat, which won't be helped, and it can actually hurt you if you take antibiotics. And then the last thing here, and actually I should also mention, one of the best ways to prevent the infection of MRSA is with proper cleaning and aseptic technique. You hear of MRSA coming about in locker rooms especially, but gyms as well, or weight rooms. And this is because you have a large population of people coming and going, and they're all getting bodily fluids on these areas. So you sweat, you have, spit, things like that. Getting that all over can easily transmit this bacteria. So it's very important that you maintain good hygiene in the gym, in the locker room, so that you prevent or reduce the chances of getting one of these infections. So what this means is that you need to be properly sanitizing equipment. You need to be washing your hands afterward. You need to be making sure you're showering, things like that. Everything you do so that you can keep any sort of these bacteria at bay so they don't end up causing an infection in you. One other thing that I wanted to mention here was tetanus. So tetanus is caused by the C. tetani bacteria. If you get tetanus, it has about a 25% mortality rate. However, this is mostly seen in the developing world, so like third world nations most likely are going to be seeing this. If you get tetanus typically in a developed nation, then really you get a tetanus shots, you get some antibiotics, and it clears it up. If you don't have access to care, tetanus can lead to what's known as lockjaw, where your muscles will contract and you can't relax them, and eventually you can't move your mouth. And this is really what ends up causing the death part, because your entire systemic muscle population permanently contracts and is extremely painful. Imagine it being your worst cramp ever, like your worst muscle cramp, but even more. That's what would happen if you had tetanus. Tetanus is usually only transmitted if you have a puncture wound from a metal object. So if you step on a nail, if you cut yourself on a fence, something like that, something where you have caused bleeding from metal, that's when you need to be cautious or cognizant about potentially having a tetanus infection. All right, so that is your overview here of Chapter 9, so on bloodborne pathogens and universal precautions. One last thing I want to mention in regards to taking universal precautions is everyone should be washing your hands, especially after you're in contact with like the public these days, or if you go to say a store. And when you wash your hands, you want to make sure you wash with good soap and water for at least 20 seconds. So the rule of thumb there is singing the happy birthday song twice, and that should be enough to give you a proper cleaning of your hands. The whole purpose of using soap is to wash off any potential pathogens or bacteria from you, or even viruses. It's not to necessarily kill them, but it's to wash them off of you. So that's it, and I will be posting here another video for you in the very near future to finish up here on Unit 5, and I will see you all later.